Hey guys, welcome to this first Screencastify recorded video of mine. Kind of wanted to do this year just to give you an idea of what's available in technology, and if you're not there, you can always get the lecture, and the lecture will always be available to you. So tonight, what we're going to talk about is communication skills. First thing we're going to talk about is kind of what the three types are. There's verbal, written, and nonverbal. All three are equally important. I think all of them, the argument is that they can all be equally as important as one to the other. Especially nonverbal is often underestimated with how important it actually is. So don't ever underestimate any types of communication, as I think they're all equally important. Verbal communication, speaking, that's really what it consists of. And the biggest thing we want to harp on here is the 5 C's. You have to understand clear, concise, consistent, credible, and courteous. If you don't understand what those are, being clear, thinking before you speak, making sure that your idea is understood, being very specific and concise, consistent with what you are saying. Don't veer off and change your story or go out on a limb and out in the woods somewhere. Stay consistent with what you're talking about and stay on your task. Being credible. If you're a physician and your specialty is surgery, then you have some credibility there. You have a reputation. You have a license that's backing you up there. It's not just you being a quack off the street and then talking. You actually have some credibility. And then be courteous. Have others' feelings in your mind as well. Be respectful. Always use ma'am, sir, Mr., Mrs. Don't just go up and use first names when you're talking to patients or anybody like that. Always be courteous. Engagement. And what we're talking about here is when you engage, like I just talked about with being courteous, make sure that you are aware and fully engaged with your patients in your care, asking open-ended questions to encourage patients to talk. An open-ended question wouldn't be something like, I bet that hurts. That's a statement. Okay? You ask something like, describe to me what you're feeling. That's an open-ended question. Now they can give you a full response back as to how they're feeling, what may be hurting them, what may be the issue, and they can describe to you in their own words the subjective feelings that they're having. And then you can couple that with your objective observations, and bam, there you go. You have a good open-ended questions. Keeps your patients engaged. Form a positive and professional relationship. This is a huge part of the medical community and the medical profession. If you don't have positive and professional relationships with your patients or your coworkers, it's going to make a toxic work environment. It's going to make a toxic environment for your patients, and they're probably not going to want to provide you much information. They're not going to want to talk to you. They're not going to want to confide in you with what their issues are, especially if it's something very personal to them. They're not going to want to open up and talk to you about it. So make sure that you're positive and you're professional with them. There's a lot of ways you can do that, building rapport, but following those 5 C's is huge. Being clear, concise, courteous, credible. Those things really, really bring a lot to the table. And avoid using slangs, being overly familiar when you talk to patients. You're not there. You've got to keep that professional relationship. You're not their friend. You're not their family member. You're there to provide them with a service, a professional service. So make sure that you're staying on those professional lines. These thinking furthers are kind of fun, but it's a myth or a fact. Sharing personal information with patients is a good way to make them feel at ease. You could say myth here. You can say, that's not true. That sharing personal information with patients is a good way to make them feel at ease. That it would not be, or you could say that it would be. Either way you go, You always got to err on the side of caution, and you've got to say that that's a myth. Sharing personal information with patients is not appropriate. You don't want to relate to them. You want to have empathy for them, but you don't need to relate to them. You don't need to make sure that you're sharing them your birthdays and your socials and how many kids you have and your kids' names and all that, because that starts to make it feel personal. When you start to make something feel personal, then the lines start to get blurred. So make sure you're always staying professional. You should always keep your conversation focused on what medical information they're there for. Whatever they're there to be seen for, that's what you're focusing on, because they're your patient and you're there to provide them the service. When we're communicating needs, wants, and emotions, we need to developing strategies to communicate needs, wants, and emotions will help you to be successful in your career. Basically, understanding how to communicate. We all, I think, internally, and we all internally deal with these wants, needs, and emotions differently. But we need to learn how to cope, and we need to learn how to be able to share our feelings, especially when we're dealing with a difficult thing. If you're an EMT, for instance, and you arrive and work a motor vehicle accident where maybe a casualty occurred, you need to learn how to deal with that, because you need to get right back on the bus and on the box and go right back to work. If you're in an ER and you have a mass casualty incident come in, you need to be able to process that quickly and get through that. If you lose somebody in the operating room, if you're a nurse or a doctor or a tech or anything like that, you make sure you're working through those feelings and those needs you need to communicate with people and have that core of coworkers that you work with and be able to share that information with each other. Being assertive, but not aggressive or demanding. There's a sense of communication, especially in the medical world, where people sometimes come off kind of brash or blunt. And it's not that they're rude or that they're mean, but it's that they're assertive. That a lot of times you don't have time to sit there and debate things or make sure that people feel like you understand them. They need to make sure that you are straightforward with them, but also respectful of them or courteous of them. So there's this fine line that you have to learn where you're at in that. Recognize when you're getting emotional. Take your emotions out of it and make sure you're looking at it objectively. That's super important. And take steps to reduce your stress. If that's faith, if that's communication, if that's writing stuff down, whatever that is, if that's exercise, you've got to take steps to reduce that stress. It's super important in the medical career field. Some of the challenges that come with verbal communication, of course, you think about things like aphasia, some sort of speech impediment, hearing impairments, visual impairments, and mental illnesses. Also, some of the stuff that we see here with various factors can interfere with verbal communication. Stereotypes may affect how you communicate with a person. Take all that out of it. Take all the stereotypes out of it. Don't focus on anything except their medical concerns. Okay? Remember, we all bleed red. We're all human beings. We all have feelings. We all have needs and wants. And what the things that don't matter are those things. Take those stereotypes out of it. And stereotypes could be skin color. They could be elderly stereotypes, like if an elderly person comes into the clinic or to an office and you talk to them really loud because you think all old people are deaf. Well, not all elderly people are deaf. Some people, everybody's in different shapes and different conditions. So take that into consideration and make sure you do your homework before you meet with those patients. Why should sarcasm be avoided when talking to patients and coworkers? This is an excellent question. As somebody that speaks fluent sarcasm, and I understand there's a place for it and there's not a place for it. When you're talking to patients, though, you need to make sure that you're not being sarcastic, because they're usually in a fragile state when it comes to their well-being and their health. And if you're talking to them in sarcasm, Oftentimes, they can misconstrue that, and it could hurt their feelings or create misunderstandings that will be more headaches for you. So just avoid sarcasm as a whole. Don't contribute to effective They do not contribute to effective communication. Telling somebody basically sarcastically that they're ill or they're going to die or that they're going to lose their limb or that this or that some people may respond to that, but you can't just take that for granted. You have to make sure that you understand that it's just not, there's nowhere that's needed. um, Hearing impaired patients, knowing ASL or American Sign Language can really be a valuable tool for you. Guidelines for working with an ASL interpreter: face your patient when you speak to them or him or her. Speak slowly, clearly, and in normal tone of voice. Don't yell at them or raise your voice to them. It's not going to help them read your lips at all. And so make sure that you understand that. Um, it's a very good tool to have no matter what. Even just understanding the alphabet, that's huge. With visually impaired patients, make sure that you're working with them with whatever assistance they need. Oftentimes, when you work with visually impaired patients, you want to make sure that you tell them where you are. Mr. Johnson, I'm 5 feet in front of you right now. It's time for you to come back and see Dr. Walker. Is it okay if I help you? Grab your right arm. My hand's right in front of you. Go ahead and reach your right arm out. We can shake hands. I'm going to place my left hand on your shoulder, and I'm going to help you walk back. Do you want to take my arm and follow me? Things like that make them feel comfortable. Make them feel that they know what's going on, and that they can picture themselves in the office. You can even tell them things like, hey, the walls are blue. There's Mickey Mouse on the walls. There's a beautiful bouquet of flowers on this painting. Make them feel at home and comfortable in their surroundings. Inform the patient what you were doing at each step of the procedure, and allow that service animal, if they have one, to be there throughout the visit. If you have a patient with a severe mental illness, this doesn't have to be retardation. This could be Alzheimer's. This could be dementia, anything. You need to make sure that they have a legal guardian there and speak to that patient first and then to the guardian. So even if the patient doesn't know what you're saying or can't comprehend cognitively what you're saying for them, make them feel like they're the priority. That's really the important thing when you're dealing with severe mental illnesses. And repeat any instructions you give the patient, so sure that the guardian understands as well. So if you say, okay, sir, I'm going to take your right hand and put right arm and put the blood pressure cuff on there, say it again. Okay, I'm going to take that right arm and put the blood pressure cuff on there, just so they kind of have an idea, even if you're taking their temperature. I'm going to go ahead and take your temperature right now. Okay, I'm going to take your temperature right now, so they know what's going on. If you have distressed patients, you may need to provide care for patients who are nervous, confused, or scared. You need to remain calm. Speak in a steady, confident voice to them. Being sympathetic. There's a difference between sympathy and empathy. Sympathy is being able to feel for them and know that what they're going through is probably difficult. Okay, empathy is being able to put yourself in that situation. Respond to them with compassion. Show them that you care. Make them feel that you care and really feel comfortable with you. And always go slow and careful when you're working with a distressed patient. Don't rush to things. Don't assume that they know what you're doing. Always communicate everything. Okay? Always go above and beyond what you think you should be communicating. When you have young patients, it's extremely, extremely important to speak slow and make them feel as comfortable as possible. Although the child patients and interactions with the parents are important, because the parents are going to be right there talking to them, make sure you make the child feel comfortable too. Saying some things you can do to make the child feel comfortable is find out where the child is most comfortable. Ask them, do you want to sit in the chair? Or do you want to sit on the table? Do you want to sit on mom and dad's lap? That's fine as well. Use an unstructured approach. Don't tell them where they have to be. Allow them to be comfortable. Don't talk down to them. Always lower your level. Get down on your knee. Squat down. Go to eye level with them. Make them feel like that you want to be at their level and talk to them. And then always offer support and praise to them. If you're listening to their breath sounds or listening to their pulse or taking their temperature. Always give them kudos for that and say, hey, great job. Look at this. Look at this tool. This is going to take your temperature. Okay, it's like a wand. I'm going to put it on your forehead, or I'm going to put it underneath your tongue or underneath your armpit, or I'm going to check your blood pressure, or things like that. That always is huge for the kids to feel comfortable and feel the want to be there and feel like they're included in the exam. Some big things, especially maybe in the South and other places that you go if you're overseas or down south, is language barriers. Especially, I think in America, this happens a lot because we're a melting pot to so many different cultures. You never know what type of culture you're gonna run into in the medical field. So some patients will speak languages different from your own. Many facilities will have employees that speak those languages or interpreters available. But you need to make sure in those times that they don't have that available to you, that you speak slowly, that you use any tools available to you to be communicated. And if nothing else, smile at them, make them feel um, loved and cared for at least. And what languages other than English are most commonly spoken where we live? Kind of in Texas, you can think about it for a second. Just off the top of my head, I can talk about Indian, Spanish, Chinese, Thai, Korean, a bunch of different languages. And if I'm leaving any out, I don't mean to. But there's just so many different languages that I know of in this area, especially in this small area that we're in. So imagine if you're in a bigger metropolitan area like a downtown Dallas or a New York City or an LA. Imagine how many different languages you may encounter in those situations. Really, communication is simple. Okay, there's a sender receiver communication model, and all it really means is the sender. So I'm the sender, you're the receiver right now. If I'm sending you a message, I'm going to think of something. How was your day? I send that by speaking. How was your day? You receive that message in your head or in your ears. You hear it. Your brain processes it. Okay, and then you send something back. That's all it is. Okay, it's just a really layman way to talk about formulating a thought, saying a thought, that person receiving the thought. Okay, there's a lot of things that can affect that ability to receive that message or understand that message or comprehend it. Imagine if a neurosurgeon comes in and starts talking in medical terminology only to somebody that's never ever read a medical terminology book or taken a medical terminology class. Things like we think about this, this is a hand. This is a hand. This is my hand. But really, the hand is made up of bones, ligaments, muscles. And so if the doctor comes in and starts talking about each individual muscle and bone, do you think I'm going to understand what he's saying? Or if he says, your index finger, the muscle on this index finger is torn. Okay, I might understand that a little more than if you say, well, your metacarpal in your distal phalange 3 is torn. Well, I don't even know what you just said to me, let alone am I comfortable now. So make sure you understand the sender receiver model. Really big in a medical field, we're going to have to make phone calls, talk to patients, family members, other coworkers. And when we talk on the phone, you talk to your friend or your buddy, you hear, hey, what's up, man? How are you? You're not going to do that on the phone at work. When you're at work, you're going to be very professional. It's going to be like, thank you for calling Dr. Conger's office. How may I direct your call? How may I help you? Answer it with courtesy, respect, be clear, concise, and even say, thank you for calling Dr. Conger's office. This is Nurse Jackie. And then they know who you are so that you give credibility to who they're talking to as well. You give the facility, give your name and title before making the call. If you do call somebody, then plan for what you're going to say. Speak slow. Repeat key information. Anytime I call somebody, if I leave a message, I always leave the phone number twice. I'll say, hey, Mr. Smith, this is Nurse Jackie calling from Dr. Conger's office. I'm calling to let you know that we have your lab results in. If you can give us a call back at 1-800-7777-11111, it'd be greatly appreciated. We'll give you those results. Again, this is Nurse Jackie calling from Dr. Conger's office, and we've got your lab results. And the number to call back at is 1-800-777-11111. And that just kind of gives them a chance to write it down, to hear it twice, and always repeat that key information. And go ahead and think further with this is what information should be included when taking a phone message. The date, time of the call, the caller's name, spelled correctly is huge. Because what if you have two patients with the same name but different spellings? Telephone number, including area code, and the message itself. Who's calling? Why are they calling? Why is it important? Who they need to talk to? Who, what, where, when, why, and how. That's really what you need to remember. And your name, whoever took the message, you need to put that down as well. When you're speaking publicly, it's important to be prepared. Make eye contact with your audience members. Don't be that person that's just reading off a note card. That's not going to help anybody. Have a concise message. Use visuals if appropriate, and practice before your presentation. Practice makes perfect. If you have a full-length mirror, or even in the bathroom, go ahead and write that stuff down and practice it. Chunk it out. Practice 1 minute 100 times, and then practice the next 1 minute, and then put those 2 minutes together and practice those. Chunking it out makes it easier for you to do that. If you have a fear of public speaking or talking to a large crowd, you need to learn to get over that fear and do it in any way possible by chunking it out, being direct, by practicing it. The more you practice it, the more comfortable you're going to be. Imagine, when you first started writing, or you first started speaking, or you first started playing the sport you play, or you first started doing whatever it is you do for fun, playing video games, dancing, cheering, playing basketball, volleyball, drill team, anything that you're involved with when you first started drawing or painting. Were you exceptional, phenomenal? Were you as good as you are now? Probably not. So it's the same thing with speaking. Practice, practice, practice. And that's what's going to make you better. When you attend a meeting, make sure that you follow some simple guidelines. Number 1, leave your phone at home or locked away, turned off. Be on time, come prepared, dress respectfully, be comfortable, but pay close attention and listen carefully. Just like I expected you in class to come prepared, be respectful, be responsible, and listen. That's exactly what you need to do when you're attending a meeting. You're there for a reason. You're there to be part of that meeting. You're there to listen, to take in the information, and to provide maybe some insight into whatever your profession is. Take part in that meeting if you're needed to or expected to. When you're in charge of the meeting or you're holding it, you send out a request, make copies of relevant materials, start in that meeting on time. If you say the meeting's going to be from 9 to 9:30, don't let that meeting go to 9:45. 10 o'clock. You're wasting other people's times. Communication in the book, it says that you can't hold an audience's attention longer than 20 minutes. After 20 minutes, it's scientifically proven that people start tuning you out. So try to keep that meeting short and sweet. Follow an agenda, take notes, send out an interview send out an overview of the minutes after the meeting so that people can refer back to that and remember what they maybe needed to do or what was decided in that meeting. What are some factors to indicate the time to end a meeting? If you have a set time, 9 to 9:30. 9:30, we got to end this. So, when the meeting starts, go, hey, dictate somebody. Johnny, you're going to be my timekeeper, okay? At 9:28, go and tell me 9:28. Just raise your hand so I know that I'm at that time so I can honor your time and we can get out of here, okay? We got to stay on track. Kind of give that person a responsibility. If you see people starting to fidget, look around the room, close their eyes, you're kind of losing them. It's time to wrap it up. No, you're not being productive anymore. If people start looking at their watches, people start thinking about it, breathing heavy, it's time to go. Attendees seem to be inattentive, all that stuff. So that kind of wraps up verbal communication for us. And if you have any questions, of course, always email me, jayson.conger@kellerisd.net. And hopefully you enjoy this and you got all the information you needed to